Good morning, you guys. Sierra here. Welcome to my channel, or welcome back to my channel. I am currently a first-year nursing student and I am in my first term of nursing school. I'm about to head out to go to clinical this morning. We got a little bit of a later start. Our clinical day is going to be a little bit different today because we're not actually going to a facility. I'm not exactly sure what we're doing, but I do know we have our dosage calc exam. So I will keep you guys posted. Let's go.
So much to the poltergeist. Trying to hold on to love, but it's frosting nice time. Much.
Hey guys, I just got back from clinical. It was a very short day, which is why it's still light out. Normally it is pitch black when I get home. I definitely want to go over everything with you guys, as well as my dosage calc exam. Lots to indulge in on that. But first, food.
Guys, there's been a slight change of plans. We're gonna go get pizza. Do we eat too much pizza? No. Do we like pizza? Of course.
Hey guys, I just wanted to talk to you a little bit about what we did in class today. Our clinical day was cut very short and we actually didn't go to a facility. We just found out that the facility that we have been going to, for lack of better words, they closed their doors to us just regarding COVID and not wanting to put their residents at risk and many other reasons, which I totally understand. We will not be going to the nursing home anymore. We will be completing the rest of our clinical hours on our school campus for this term, and then hopefully be able to go to the hospital next term. And I got to school, we had a 3-hour presentation by one of our instructors regarding a woman's pregnancy from conception to actually giving birth. It was very in-depth, maybe too in-depth. After that, I had my dosage calc exam, which I'm not going to go into. I'll talk to you guys about that in another minute. And I got together with my clinical group and we filmed our video for our community needs project. I told you guys that we're doing a hand washing interactive video for children at the Boys and Girls Club. We were able to film that pretty quickly after our exam. Now we're getting pizza and I will get back to you guys.
When I light from a forest sky, apply to the forces above us.
That pizza was well needed. I swear I don't eat it that much. Anyways, I wanted to sit down and chat with you guys about my first dosage calc exam. The basics are the exam itself is worth 100 points. There are 25 questions. To pass the exam, you have to score 100%. This is because this is something that is just so important as a nurse. I mean, if you're watching this video, I'm sure you know why. Being able to do dosage calculations and administering medication is so dang important. Trying to reduce as many errors as possible when it comes to our patients. You have to score 100%, which is actually why they give us 3 opportunities to pass the test. As far as I know, the exam itself stays the same. All 3 times we get to take the exam, it should be the same exam, which is actually why we just got an email from our instructor asking us kindly to not discuss it amongst our class and our cohort, just to uphold academic honesty and integrity, which makes sense. A lot of us were wondering what happens if you miss one? How will we know what we need to work on if we're not going over the exam? And so our teachers are sending us kind of like a little code word about what we missed on the exam. If you missed conversions, you would get an email saying conversions. If you missed something about administration, you'd get that. If you missed something about safety, you'd get that. I'm just gonna cut right to the chase. I already got my score back and I missed 2. I'm not surprised because I don't know if anybody else is like this. When I take a test, if I don't know the answer, I just come back to it, because sometimes if I come back to a question, it'll pop into my head magically, or the following questions will kind of help guide the question that I don't know in a weird way. There was this one specific question I just had no idea about. I just chose the best answer I thought possible. I had a feeling walking out of the test I missed that one. And at the very end of the test, there was a question that was to check all that apply. And you know how great those ones are because it just gives you ample opportunity to miss it. I believe I missed that one too because I was teetering back and forth whether or not to check 2 or 3. I needed to check 3. I missed 2 problems and I already know it was those 2 because, again, I don't know if anybody else does this, but right after an exam, I can't stop thinking about some of the questions that I wasn't sure about, so I just pull out my phone or my textbook and I just look it up immediately. I have to know if I got it right or wrong. It's a peace of mind. I was pretty much well aware I missed those 2, so I wasn't surprised. when I got my score back, and then I wasn't surprised from my instructor's email regarding what the 2 questions I missed were about. Now, one thing that really caught me off guard about this exam was I was expecting there to be a lot more math, a lot more dosage calculations, the basis of what I was studying for this exam. I would say 50% of it was the calculations in the math, and then 50% of it was proper administration, safety techniques, what you are accountable for as a nurse, how to take orders, just sort of things like that. And I studied up on the math, but I didn't study up as much on the protocols. So the 2 that I missed were actually the protocols. They were under the guideline of safety standards. I'm not going to tell you exactly what they were because I have to keep that confidential, but a lot of the questions regarding the protocols were scenario-based questions. For example, a doctor prescribes a patient 200 milligrams of X medication. This is scribbled on a piece of paper for you to read from the medical doctor, and you aren't exactly sure if it says 200 milligrams or 200 micrograms, something like that. So you administer 200 milligrams, but it was actually 200 micrograms. Who was at fault for that administration? Things like that. Scenario-based questions of scenarios that can totally and will totally happen once you do become an RN, and how to handle those sorts of situations and uphold the most integrity and autonomy of your patient. I definitely was thinking anybody that had prior experience being a med aid probably didn't struggle too much with this exam. I actually don't know anybody that did get 100%. Everybody in my cohort discussed our grades, and a couple people missed 1, there was a couple people that missed 3, and then there was somebody that missed 5. I think it's pretty normal not to pass the first time you take your exam. So if you don't feel bad, because I didn't either. So that's why we're going to retake it.
Much, but a light from a falling sky. Fly to the forces above us like.
As with taking any first exam, it's so nerve-wracking just because you don't know what to expect. Now I have an idea, and I don't think that they're too bad. I just wanted to be transparent about my exam and the whole process of it. It's getting kind of late, but I have some clinical homework that is due this weekend, and I would prefer to get it done, or get most of it done tonight. I think I'm gonna get started on some of that, and I'm actually gonna show you guys what exactly I'm doing. Yeah, let's get to it.
Alrighty, so here is the competency document that we follow for the first 10 weeks of nursing school. Each week has an objective, and the goal is to apply that objective to an experience that we had in clinical that week. As you can see from my little sticky note, my homework assignment for clinical this weekend are competencies week 4, 5, 6, and 7. I have opened a separate Word document and copied and pasted the competencies that are due this week. When turning this assignment in, it is required to have the full competency placed above your response. Your response needs to be 1 to 2 paragraphs in APA format. Once I have finished with my document, I open up my clinical judgment worksheet. This worksheet is the template for my clinical class where all of our assignments get placed. I scroll down to the competency section and paste my work here. We are asked to use references in our assignment, and this is where those would go. And that is pretty much it.
Thank you guys so much for watching this video and hanging out with me. I really appreciate it. I believe this accurately portrayed a day in my life as a nursing student for clinical. Although this wasn't an extremely normal clinical day, I'm sure everybody can relate to that because clinical days will vary, especially with everything that is going on in the world right now. Again, thank you so much for watching, and chances are if you liked this video, you will probably like the future videos I put on YouTube because I will be in nursing school for several more years. So please like and subscribe and follow me along my journey. Thank you guys so much. I will see you very soon. Bye.